Hi there, my name is Karen Reynolds and I am an acupuncturist and registered nurse in Corte Madera, California. And this edition of Ask the Expert is about autoimmune issues, inflammation, and nutrition. And so for those of you who might not understand what an autoimmune diagnosis is, medical diagnosis, it includes things like type 1 diabetes, rheumatoid arthritis, psoriatic arthritis or psoriasis, multiple sclerosis, systemic lupus erythematosus, also known as lupus, inflammatory bowel disease, Addison's disease, Graves' disease, celiac disease, pernicious anemia, myasthenia gravis, and Hashimoto's thyroiditis. That is not an exhaustive list, but those are very common autoimmune diagnoses that people suffer from on a daily basis. So if you have any of these, this will be a helpful video for you. So this particular edition is about inflammation as it relates to things that you might be eating, and if you have any of these particular diagnoses, it could be making your symptoms worse. So the first thing that I recommend to anyone with any autoimmune type of diagnosis is to cut out wheat or gluten from your diet, which some people consider that to be excessive, but here's why you should consider doing it. So wheat and gluten are very inflammatory in the body. They're kind of like throwing gasoline on a fire. And for people with autoimmune issues, you already have a lot of internal inflammation. So adding to that inflammation is not really going to help you. And also the wheat that is used in the United States, at least, is GMO. It's genetically modified as opposed to European styles of wheat. And the body can see that as a foreign substance and react to that in an inflammatory way. Sometimes I will have people say to me, well, can't I just have a piece of birthday cake once a year? Isn't that a little bit okay? For someone that has an autoimmune diagnosis, even one exposure can ramp up your white blood cells, your lymphocyte activity, for as long as 8 months. And this means that you would be more prone to having flare-ups for 8 months after that one piece of birthday cake. So what you can do if you have autoimmune issues and you're concerned about your diet or you're considering changes to your diet is you could seek the help of a clinical nutritionist. This is different than a dietitian. A clinical nutritionist has a considerable amount of more training. They also do a lot of lab testing. It might be something like ALCAT testing, in which your blood is exposed to about 200 commonly eaten items, and they look at how your white blood cells respond. And if there's a high response, an elevated response, they would have you avoid that food for a period of time. The other thing you can do if you are a person with an autoimmune diagnosis is to seek acupuncture. Research shows that acupuncture has the ability to decrease inflammation. It also has the ability to increase circulation, and it has the ability to increase nutrients that the cells need to repair and be healthy. So this is the Ask the Expert issue for today, and if you have any questions, do please feel free to contact me. Thank you so much.